Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. And joining us for today's media briefing are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and available to answer questions is Dr. Stephanie Schauer, the Wisconsin Immunization Program Manager. We'll begin today's briefing with remarks from Dr. Ryan Westergaard.
Good afternoon, and thank you for joining us. As we begin, I'd like to share some updated data to help paint a picture of the realities we're facing here in Wisconsin. As of yesterday, 13 counties have moved into the critically high case activity level for a total of 21. All other counties in Wisconsin have reported a high case activity level. Wisconsin as a whole is also at a very high activity level. We're reporting 2,340 new confirmed cases today. Our 7-day average of new daily cases is 2,416, which is up an increase of 1,665 from 1 month ago. Preliminary data shows that case rates among children under 18 has reached levels last seen at the height of last fall's surge. Statewide, 96% of ICU beds and 97% of intermediate care beds are currently in use. That means many of our hospitals are operating at capacity or will be at capacity in the coming weeks or even days. Today, we're also reporting that 17 more Wisconsin residents have died from COVID-19. Our total deaths have now reached 7,997. Our hearts continue to go out to the families and friends who have lost someone to this disease. Due to the highly infectious Delta variant, COVID-19 is continuing to spread in our state. It's stretching our hospital capacity. With cold and flu season right around the corner, it's important to get your annual flu shot to help keep you and your loved ones out of an already burdened healthcare system. And similar to the recommendation that you get a flu shot every year, certain populations who are at increased risk of exposure to or transmission of COVID-19 are recommended to get a COVID-19 booster dose. And that's what we're here to talk about today. Evidence suggests that immunity is waning over time for some people who were initially well protected by the vaccine. For these people, a booster dose will strengthen and extend their protection against infection, serious illness, and hospitalization and deaths from COVID-19. It's important to remember that all the authorized COVID-19 vaccines offer strong protection after the primary series. Getting every eligible person vaccinated continues to be our most important strategy for preventing severe disease, hospitalizations, and deaths. With a high level of disease transmission in Wisconsin, we continue to urge everyone who is not already vaccinated to get the COVID-19 vaccine, and for all people to add additional layers of protection, including wearing masks indoors, staying home when you're sick, and avoiding large indoor gatherings. Each of us can take action within our own communities to help slow the spread of COVID-19. Thank you.
Thank you, and we're now ready to take your questions. A reminder to maintain audio quality, please remain muted until it is time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. In the interest of time and to ensure that everyone is able to ask a question, we ask that you limit yourself to just one question per reporter. And we'll begin this afternoon with Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. So my question is around the cost of vaccination versus not being vaccinated with regards to hospitalizations and that impact on programs like Badger Care and some of those programs. Can you kind of frame that out for me a little bit better?
Your audio quality is a little poor. Let me see if I understood the question. Is it about the costs to the state or to the cost to the healthcare system that are incurred by by people not being vaccinated?
Correct.
Okay. So that's a large topic that requires a good health economic analysis, and we don't have data to share with that for this briefing right now, but it's something that we can look into. I'm sorry, I don't have numbers about estimates of cost savings or extra costs, but generally speaking, the costs to healthcare systems and therefore in other health insurers has been tremendous due to the increased severe illness, ICU cares in particular related to COVID-19. So every severe illness caused by COVID-19 is an expensive condition to treat, and that's going to add costs, but we don't have a careful analysis that I think will answer your question directly.
Thank you. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks again for doing this call. Doctor, could you address, I've heard some reports of healthcare providers suggesting that their patients who had the J&J vaccine go ahead and get a booster from Moderna, from Pfizer, even though that's not what the CDC is recommending. Does DHS have guidance for healthcare providers and for patients who have gotten the Moderna or the J&J vaccine when it comes to boosters?
Yes, thank you. We do have guidance about that, and it is to not give boosters to anyone outside of the population for whom they are currently recommended, which includes people who received Pfizer as the primary series. And we can talk more about those specific categories. There were 4 categories if needed, but the practice of providing booster doses to people outside of the groups who received Pfizer is not appropriate and not recommended.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Yeah, thank you. So there's been a lot of debate about sort of focusing on vaccinating those who haven't had their first shots here and around the world versus providing boosters. What impact do you think boosters will make on the pandemic, including the Delta variant wave here in Wisconsin and elsewhere?
Sure. I would first underscore the first part of your question, which is that getting the initial series, if people have not gotten the initial vaccine series from any of the authorized COVID-19 vaccines, is probably our strongest recommendation to the public. Getting everyone vaccinated with an initial series will have the biggest impact in terms of turning the tide against the Delta surge of COVID-19. Now, that being said, the data that were reviewed by the CDC's advisory committee last week and the FDA committee the week before that showed that even though the Pfizer vaccine primary series was highly effective and has translated to many saved lives and averted hospitalizations, when we follow the data out 6 months or more, the level of protection, the percent efficacy, seems to be waning. So that could have important consequences for highly vulnerable patients, such as the elderly and people with weak immune systems or other chronic conditions. So the evidence clearly favors that the potential benefits of doing booster doses at this time outweighs the risks for those, and therefore we can save additional lives and potentially prevent additional hospitalizations by strengthening the immune response in those populations where there's been some evidence that the level of protection has waned. So both are true. Primary series is still extremely important and probably the most important thing. But if we want to do ensure maximum protection, now appears to be the time where we can start and should start giving booster doses to people who have been vaccinated 6 or more months ago if they have some of the high-risk conditions that are described in the recommendations.
Thank you. Now to Alex Moe from WisBusiness.com. Alex?
Hi, thanks for taking my question. So are all providers in the state that were already offering Pfizer vaccinations able to give booster shots to those who are eligible, or is availability for the boosters more limited?
So that Dr. Stephanie Schauer, who leads our immunization program, is on with us today, and she's probably in a good position to answer that question. So I'll defer to Stephanie.
Yeah, so, the network of providers that we have, which is over 2,400 providers, can go ahead and provide all of the authorized vaccines. and that is for both the primary series as well as the boosters. It's important to note that the vaccine that is for the booster, it's the same vaccine whether you're giving the primary series or the booster. It's the same vial, the same dosage. It's just the recipient sort of determines which one that ends up being in terms of being counted. So yes, and I think that's an important point, is that we do have a wide network of vaccinators available to give both the primary series and the boosters. It is important for folks who are looking for the boosters to check and make sure they have the Pfizer product. As Dr. Westergaard mentioned, the recommendation is only for Pfizer recipients at this time to receive a third dose of Pfizer, or 6 months after the completion of the series. And so they can do that by either calling or going on to vaccines.gov and making an appointment, or just checking to see.
Thank you. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Yes, thank you for taking the question. Dr. Westergaard, you were just talking a little bit about the data that's showing of the vaccine's effectiveness in some cases beginning to wane in some of these individuals who probably were earlier because they were eligible earlier to receive the vaccine than the general population. How soon do you anticipate that the general population is going to start to have the effectiveness wane and likely become eligible as well?
So that is a good question. I mean, and all we know is that the data that we have so far shows that it's at 6 months, the level of protection remains high enough that we are not recommending boosters. So really, we can't answer that question until we observe what happens in large numbers of people without weak immune systems or chronic medical conditions, to see if the risk of particularly severe disease is increasing among vaccinated people over time. If we see that the level of protection wanes, then then the recommendations are likely to follow. But the data that we have right now really justifies only booster doses for that higher risk category. So time will tell. It may be 12 months. It may be longer. We will learn when we get the data.
Thank you. Now to Kent Wayne Scott from WISN TV in Milwaukee. Kent? And a reminder, *6 unmutes your phone. Kent Wayne Scott from WISN.
Hi, this is Terry Sater, Kent's colleague, answering because Kent is not on the call. Couple of questions. How soon will booster shots be available for J&J and Moderna fully vaccinated people? And of the Pfizer recipients who are fully vaccinated, what percentage of those people are eligible for booster shots now?
So there were two questions. The first question was about, do we know the timeline for approval or authorization of boosters for people that received Johnson & Johnson or Moderna? We do not. The process will be the same. The manufacturers will submit data and a request to have booster doses authorized. That is happening probably imminently, if not already. And then the data get reviewed first by the FDA Advisory Committee, and then the CDC Advisory Committee on Immunization Practices, and we will have a recommendation. So that process will need to play out. Again, I haven't heard a specific timeline. The second question was what proportion of Wisconsin residents who received the Pfizer vaccine as a primary series are eligible for boosters. I don't know that precisely. Dr. Schauer, do you have an estimate of that, or can we get back to that?
Yeah, it's a bit hard to go ahead and estimate, because not only does it include individuals with high-risk conditions, but also individuals in particular occupations, as well as individuals may based on their own individual risk and their occupation, may make that decision. So there's some gray area regarding that we just don't have that data for. We do know that all 65-year-olds who received Pfizer certainly would be eligible, but some of those other groups are a little more difficult to put a number on.
Thank you. Now to Rhonda Fox from WKOW-TV in Madison. Rhonda?
Hi. Hi, thank you for taking my question. So I just talked with UW Health, and they report people have been mixing vaccines, one, because they feel it provides a broader protection against COVID-19 and the Delta variant, and two, because Pfizer is the only vaccine available right now that has a booster shot.
Are you still with us, Rhonda? Well, she got cut off, so hopefully she'll call back in again, but we'll continue on with Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. I was just wondering, can you talk a little bit about what DHS is going to do to help get booster shots into long-term care facilities and what they're doing to help facilities administer these shots? Thank you.
Yeah, and I can take that one. I think first thing is to, if folks recall, is that for our skilled nursing and the assisted living facilities, who we use the Federal Pharmacy Partnership Program, is that we had them deliver Moderna vaccine. So at this particular juncture, though many of the individuals in long-term care facilities are not yet eligible because of having received Moderna and not yet Pfizer. However, we still continue to plan and work with them. We have worked with all of the skilled nursing facilities and have assured that they have a vaccinator already lined up to provide vaccines when folks become available. And then we continue to work with the assisted living to also make sure that they have options for vaccination and have a vaccinator lined up. For some of them, that may mean a pharmacy going into that particular facility, and for others who may have a sort of a smaller group home where folks may be younger or more mobile, is they may be able to make an arrangement where they can take folks to a local pharmacy at a prearranged time and ensure that they receive vaccine in that way. So not only are we engaging pharmacies and building on the relationships that were built for the first go around, and for many of the vaccinators we now have in the space, we now have many more vaccinators, pharmacies, commercial vaccinators, not to mention local and tribal health and healthcare providers, all who have played an important part in vaccinating this part of the community. So really continuing to rely on that even more robust structure in place. And then certainly where there are gaps identified, the state certainly working with locals and making sure that every facility has an avenue for vaccination for their staff and their residents.
Thank you. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking this. I'm wondering about what the data has shown about people who have had breakthrough cases and whether they are predominantly people who fall into one of the risk factors or other criteria that in fact make people eligible for boosters, and whether there's a link there in a sense in terms of the booster recommendation. Thank you.
Yeah. Thank you. That's an excellent question. So what we've been able to report and have been analyzing so far are overall numbers of individuals who have tested positive, been hospitalized, and or had a COVID-19 related death in the populations related who have been fully vaccinated and not fully vaccinated. And our summary of those data are available on our website on a tab called Illness After Vaccination. There is an age breakdown to those data on our page, and it is true that older individuals are more likely to have breakthrough infections, similar to how they're more likely to have primary infections. We don't yet have good data about the proportion of breakthrough infections related to things like occupation or coexisting medical conditions, although it's an important thing to look into. But for details, I would recommend you look at our data page on the vaccine after, or illness after vaccination page, because it's summarized nicely there.
Thank you. Now to Megan Kernan from WBAY TV in Green Bay. Megan?
Hi, thank you for taking my question. I was wondering if there is a fear that the rollout of booster shots will lead some people to question the effectiveness of the vaccine in the first place.
So that, I think that's also a good question. I mean, I think our job here, and we consider you in the media partners for this job, is to actually communicate clearly to the general population what the data show, which is that both are true. The primary series of the vaccines are remarkably effective at reducing illness, particularly severe illness and hospitalization and death from COVID-19. That was and is true and supported by really strong data. It's also true that when we've observed people who are more than 6 months out, that level of protection, while still protecting, might be going down. So if we want to be in a posture where we're doing everything that science tells us we can do to prevent COVID-19 deaths, boosters are appropriate. But that in no way takes away from, it makes that no less true that the primary vaccine series are also remarkably effective. So I would look at it more as, well, booster actually is a good way to look at this. We are prolonging or extending the potency or the high level effectiveness of the vaccines, which are effective to begin with, but might decrease over time. It's a little bit complicated, but the data tell a pretty clear story, and we appreciate all of your service in helping us communicate that to the public, because as we all know, there's plenty of misinformation around, so being able to tell that story with clarity is really valuable, and we appreciate all you do for that.
Thank you. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thanks for taking my question. I was wondering if vaccinators are required to report the number of booster doses that they're giving out to DHS. So essentially, if you guys are tracking that information about boosters, and if you plan on reporting that on your DHS summary data page. Thanks.
Yeah, so, as with all COVID-19 doses, the registered providers are required to go ahead and report that information to the Wisconsin Immunization Registry, regardless of whether it's the primary series or the additional dose for immunocompromised individuals or now the boosters. So all that information continues to come into the Wisconsin Immunization Registry, and it is our plan to go ahead and provide that information, in the near future on our website for folks.
Thank you. Now to Tony Atkins from WTMJ, TMJ4 in Milwaukee. Tony? And a reminder, *6 unmutes your phone. Tony Atkins from TMJ4. And we'll move on then to Michelle Melby from Fox 11 in Green Bay. Michelle?
Hi there, this is Ben Krumholz filling in. Thanks for taking the time. Supposedly, some providers were providing booster shots before the official approval. Are you tracking that? Will they be receiving some sort of violation? And will providers be receiving some sort of violation for mixing doses, giving the Pfizer booster to people who received Moderna or J&J? Thank you.
So I can start with that. I mean, I think certainly we do go ahead and look at the data in the WER and do identify practices whereby clinicians may be inadvertently giving doses incorrectly, and do some follow-up to make sure that they are following the current ACIP guidance and really provide technical assistance. It's so important that providers continue to stay within the EUA because that is really where they have the most protection. It's where the data is supporting and what the recommendations are. And so they do need to stay within that. And so we do work with providers to make sure that they are doing that. With respect to the boosters, we have had the recommendation for immunocompromised individuals to receive a third dose at least 28 days after their the second dose or their primary series finishing. And it's difficult for us to know if they're administering it because of that reason or if it were a very early booster. So we do continue to provide information and reminders and technical assistance to our stakeholders on weekly webinars and through written materials, really encouraging them to follow the data-driven recommendations.
Thank you. Now to Hope Kerwin from Wisconsin Public Radio. Hope?
Hi. Hello. It seems like the criteria for getting a booster for someone with an increased risk of exposure from a workplace setting, that could include a lot of people. So I'm wondering if you could talk about, are you recommending all manufacturing workers, for example, plan to get the booster, or, what recommendation, I guess, would you have for those very broad categories?
Well, Stephanie may have the list of specific conditions handy. They are not infinite, and they are also potentially not carved in stone. As we get more data, the list of occupations and roles for which boosters are recommended might change. But in general, and this is actually a nuance in the booster dose recommendation, is that while the two categories of individuals over 65 and those who are older and have a chronic medical condition, the recommendation is that they should get boosters. People who are at higher risk by virtue of occupation may get boosters. So the language is different. And what that means, or what's behind that, is that the data are not as strong that they provide benefit as they are for the older population. So the language of the recommendation says that individuals should consider their individual level risks and benefits, and if they determine that a booster dose is right for them, they may get it. But it is not a blanket should get a booster dose in the same way that it is for people who are 65 and older. So why might some people consider that if they are in one of those occupations? Well, it's because it's essentially their personal risk of severe disease, their likelihood of being in contact with someone who might be infectious, and perhaps their ability to use all the other layers of protection, such as masks and social distancing. So in those categories that are defined by occupation, it really is an individual decision. People are encouraged but not required to talk with their medical provider so they can weigh risks and potential benefits if they're in that group. And that's what we encourage people to do, is be informed about the science, talk to your provider, and determine whether a booster shot is right for you. But people who are older and people who are greater than 50 with medical conditions, the data are pretty clear. And the ACIP committee felt comfortable saying that all people in those categories should get a booster, and the evidence that that would be beneficial is clear enough to make a stronger recommendation.
Thank you. Now let's see if Rhonda Fox from WKOW-TV has rejoined us. Rhonda?
Yes, I am. Can you hear me?
Yes, we can. Please
Hello?
go ahead.
Perfect. In Wisconsin, are you seeing people mix vaccines? If so, how prevalent is this, and are there dangers in mixing vaccines?
Well, Dr. Schauer just addressed this question partially. When providers administer vaccines, they are required to report that data into the Wisconsin Immunization Registry. So we do see, assuming that they enter those data, that there are some mixed doses. In general, it is not recommended or not allowed to mix vaccine doses, with one exception, and that is the recommendation for additional doses of mRNA vaccine, the Pfizer or Moderna, for people who have weak immune systems. This was a recommendation that preceded the more recent booster dose recommendation for a larger population by several weeks. And the concern there was that if an individual who has a weak immune system because of cancer treatment or treatment for an inflammatory condition or organ transplant, they may have not responded initially to the Pfizer or Moderna vaccine, and giving a third dose 28 days later can be beneficial and should be recommended. Now, there was language in that recommendation that you ought to, and we strongly encourage people that the norm is using the same product for that third dose as the first two. But if there were not available in the region, they allowed for mixing doses. So mixing doses should be very rare, and in most cases, and in all cases related to people who are eligible for boosters, rather than that smaller category of people with weak immune systems, it is actually not allowed. And the ACIP, the committee for the CDC, specifically did not choose to recommend booster doses for people that received the Moderna series for their vaccine for their primary series or Johnson & Johnson. More data will be coming. Those decisions will be revisited in the future, but as of right now, there's no recommendation to give booster doses unless the primary series was the Pfizer.
Thank you. Now let's check and see if Tony Atkins from TMJ4 in Milwaukee has rejoined us. Tony? And a reminder, *6 unmutes your phone. Tony Atkins from WTMJ. All right, then. Well, we do have a few minutes left, so we can go back around for any follow-up questions. We'll go down the list and until we have time. And we'll begin with Denise Lockwood from Racine County I. Denise, do you have a follow-up? Okay, moving on then to Scott Bauer from the Associated Press. Scott.
Yeah, thanks for the opportunity for follow-up. Dr. Westergaard, as I look at the graph of new cases, it does appear that we're on a bit of a downward trend from the past week or so. Do you, and I realize, I appreciate your opening comments about the critically high levels, but is there enough data to show that maybe we hit the peak a week or so ago and we might be on the downside here?
Yeah, thanks for that question. I don't think there's enough data to say that we've reached the peak or on the downside. There is a formal definition for that CDC has applied, and I guess one piece of good news is that in many states around the country, particularly in the southern regions, which really had a large surge about a month ago, there is a statistical signal that new cases are decreasing. So the trend of shrinking cases. There's not yet, as of early this week, been an indication that hospitalizations or deaths are decreasing, or specifically that deaths are decreasing. But cases seem to have turned the corner in the southern states that had the earlier experience of these Delta surge. So we have not seen that signal in Wisconsin. We cannot conclude that we've plateaued or turned the corner. We're very hopeful that we have, that the trend that we've seen in other states is encouraging. One potential reason for concern, in my view, is the weather. This was a time last year when we had a fall surge of cases, and then as the weather changed, as activities moved indoors, we saw that continue to go up. And that's an issue that really hasn't been experienced elsewhere in the country, so we need to remain vigilant. I think it's a mistake to assume that, because after 2 months, the Delta surge kind of ran its course in Florida, that we just need to hold tight and it'll run its course here in a few weeks. We very much hope to see that. We can't get to the other side of this Delta surge soon enough, but it won't necessarily happen by itself. We need to continue to implement prevention strategies and remain vigilant as the situation changes. And as all respiratory viruses tend to pick up around this time of year, that is potentially a contributing factor why we may not turn the corner as fast as some of those states in the southern part of the country did. But so in short, we're hopeful, but I don't think it's accurate to say that we've so far seen evidence that this surge is on the decline.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David, do you have a follow-up?
Sure, thank you. So for those people for whom boosters are recommended, obviously flu shots are also recommended. What do you say to people who may have concerns about getting both around the same time or at the same time?
I'm sorry, getting a booster dose at the same time as
a flu shot.
As a flu shot, yes, that's a good idea. For all vaccines, we recommend co-administration, and this is based on a lot of experience that multiple vaccines can be given, concurrently, and they remain effective. And I think the very important principle that we should not miss any opportunity to vaccinate a person who is eligible for influenza and for COVID-19. So I think co-administration is an efficient way to make sure that we're protecting people against the Delta variant, which is widespread transmission in the country and in the state, and influenza, which is not currently spreading at high levels, but traditionally does every year during the winter. And getting people protected from influenza by getting a vaccine at the same time as their booster is a certainly appropriate strategy. It's not required that they get administered at the same time. We just want people to get both doses if they're eligible. And to remind you, every Wisconsin resident aged 6 months and older is eligible and recommended to get an influenza vaccine. And we don't know what to expect, frankly, with influenza this season. There was very little flu 1 year ago. We don't have any reason to know which way this is going to go this year. It could be a very bad flu season, and having as many people vaccinated from influenza could certainly be an important strategy to protect our hospital capacity and to save lives. So whether you get them at the same time or a different time, the recommendation is to get both.
Thank you. Now to Alex Moe from WISbusiness.com. Alex, do you have a follow-up? Alex Moe? Okay, we'll move on then to Jonathan Neiser from NBC 26.
Thanks for the opportunity for a follow-up. Back to Dr. Westergaard. I know someone asked a question earlier, somehow tied to breakthrough cases, and I've been kind of looking around trying to research a little bit on that myself. Can you just share any key points or takeaways when you look at the data on the impact that breakthrough cases has on the overall picture of what we're seeing with Delta at this point?
I think the additional context that might be helpful is that breakthrough infections happen in significant numbers. Breakthrough related cases that result in hospitalization are relatively more rare, and deaths due to breakthrough infection is much less likely than deaths due to an infection in a previously unvaccinated person. While those things have translated to, what we see is that the large majority, I don't have a specific proportion, but other states have tracked this on their website, and it's been sometimes 90+%. A large proportion, the large majority of people who are hospitalized with COVID-19 in Wisconsin and the country right now are not vaccinated. So we track and we care very much about how often breakthrough infections happen, because that is a source of insight for some of these decisions that we need to make about booster doses. So it's very important to track them closely. But the contribution to our our death counts and our hospital system capacity being strained is overwhelmingly driven by people who have not yet received any dose of vaccine. And that was a point that we led with, that priority number one, strongest recommendation coming from us today is that if someone has not yet been vaccinated for COVID-19 at all, getting vaccinated is extremely important, extremely beneficial. And if people have questions or concerns about that, find a trusted source, talk to their provider to listen to their concerns, to potentially correct misinformation and help people make a wise decision with respect to their health. Because we are very confident that when we listen to people who have concerns or hesitancy about the vaccine, we communicate what the science tells us, that the safe decision for one's health strongly favors the decision to go out and get vaccinated. So we want to continue those conversations, continue to encourage, but also continue to support people who have not yet made up their mind and respect that they've not yet made up their mind, and help support people and encourage them to get vaccinated for COVID-19. It's really our number one priority right now to reduce additional hospitalizations and deaths from the pandemic.
Thank you. Now to Terry Sater from WISN in Milwaukee. Terry, do you have a follow-up?
I do. Thank you for the opportunity. Dr. Westergaard, are you frustrated that while you're encouraging people to get booster shots, there are approaching nearly 3 million people who received Moderna or Johnson & Johnson who don't even have that option right now if they're eligible under those health conditions?
So is it frustrating? No, I think it's the right call right now. And why I think that is, when we make recommendations that really are intended to be listened to by millions of people, right? This is not someone coming to me in the office and talking about the risks and benefits and how it affects their lives, and we can sort of engage in shared decision making. This is, public health and medical authorities making a recommendation, a one-way recommendation that reaches millions and millions of people. If we're going to do that, and preserve the trust that people have in that process, we need to stick very, very closely with what the science says definitively or very clearly. And right now, the science is pretty clear. It's been vetted. It's been reviewed by some of our best experts in an open forum, have determined that the science supports boosters for people who received Pfizer. That process has not yet happened. That data have not been reviewed carefully in a public forum that would lead to a similar recommendation for Moderna and Johnson & Johnson. And it is what it is. The process that we have is so important that I think we should encourage people to be patient, to do the other things beyond vaccination to keep ourselves safe, the multiple layers of protection, and watch closely as the data come in, and hopefully recommendations for booster shots will follow. But we don't want to get ahead of the science, because that really important trust in having a process that's really tightly, firmly grounded in what we know with certainty from good science is so important on which to make these decisions that it's really dangerous to get out ahead of it. And I think that's why it's the right call right now to limit booster doses to people who received Pfizer, people who received Moderna or Johnson & Johnson. Those data, trust us, are being collected and analyzed and will be reviewed in a similar fashion someday. They just haven't yet so far. So it's one of those situations where we just need to ask for patience and understanding so we can give the best advice that we possibly can.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Do you have a follow-up, Sean?
Hi, thanks for the opportunity for a follow-up. I was just wondering, for the state's testing capacity, as we see more and more businesses come online with requirements that people either get vaccinated or have to show negative COVID tests, are you concerned about the possible overwhelming of the capacity in the state, or do you think we're in a good spot with testing capacity? Thank you.
I think there's been a lot of work and a lot of resources through, for, over a year and a half to get testing capacity where it is right now. So we feel good and proud that a lot of people have worked hard to scale up testing. Is it perfect? No. We'd still like tests to be easier. We'd like tests to be available with a shorter turnaround time. Those are really always going to be areas where things could be better. But in general, people who need a test and want a test can get one right now. We have a lot of different options. We have our testing task force has generated informational resources that are on our website. So we have good resources to connect people to tests if they're not finding it easy, and we encourage people to take advantage of those. So testing remains very important. We have good test capacity, but it's not to say that people might need a little extra help finding a test and that it can't be better. But right now, tests are not in short supply per se.
Thank you. Now, Eric Gunn from Wisconsin Examiner. Eric, do you have a follow-up?
Yes, thank you. Thank you. Dr. Westergaard, I want to go back to the flu. Why wasn't the flu so bad last year? Was it because people were masking a lot? Was it because even though there wasn't a safer at home order, people were still refraining from gathering last fall? But then the COVID surge would maybe, I'm not sure about that. Does anybody, have their public health folks sort of teased out why the flu season was as mild last year as it was? Thanks.
Yeah, no, it's a great question, a really interesting one. The answer is probably all of the above. I don't know that we have a definitive answer. Year to year, the severity of the influenza season changes in ways that we don't always understand. But I think a key lesson from 2020 to 2021 respiratory virus season is that prevention strategies like wearing masks and watching social distancing and avoiding crowds, all those things that we recommended to prevent COVID, but didn't do well enough, frankly, to really stop COVID, those were sufficient to stop transmission of influenza. That makes sense when we think about what we've learned by studying the virus, that SARS-CoV-2, the virus that causes COVID-19, is several times more easily transmissible than influenza virus. So that's probably the reason. We can get a B- on our efforts to prevent COVID-19, and that's enough to ace the test of preventing influenza. The concern now, though, for the coming respiratory virus season is I'm not sure we're still getting a B- in doing the prevention strategies like wearing masks and watching distancing. I think generally speaking, masks are being worn less often around the state, and people are engaging in close gatherings the way that they did before the pandemic. And so that's one of the reasons that we're certainly not counting on it being a mild flu season this year. So that's sort of how we're thinking about it. Time will tell. We never know how bad the flu season is going to be until it's over. But it's a reason for everyone to be prepared, and getting the influenza vaccine, getting everyone's flu shot early this year, anytime starting now, if you haven't gotten it already, is going to be really important.
Thank you. Our next follow-up belongs to WBAY in Green Bay. WBAY. Okay, moving on then to Rose Schmidt from CBS 58 in Milwaukee. Rose, do you have a follow-up?
Yes, I do. Thank you so much for allowing this opportunity. I want to go back, Dr. Westergaard, to last week. I know that the FDA advisors had overwhelmingly rejected to make boosters available for everyone 18 and older. We talked to an organization in the state last week that was upset about that and said, I wish that they had just opened up this boosters categories to everyone. Can you talk about sort of what the data is showing and why these specific groups should get a booster / may get a booster, and kind of why they decided not to open it up to everyone? Thanks.
I think generally what the evidence suggests is the balance of benefits over potential risks. And the data and the evidence that the ACIP reviewed showed increases in hospitalizations and severe infections among people who are older in a way that was not, the data did not support it for people who were younger without medical conditions. So there really just wasn't evidence that there's a lot of benefit right now. And so, like I said before, we need to make our recommendations based on good evidence. So the data weren't there to make that call. You know, in general, the risks of COVID-19 vaccination are very small, even compared to many other vaccines that we're using, but they're non-zero. And for example, people who have received the mRNA vaccines, the Pfizer and Moderna, there have been relatively small, but not insignificant numbers, particularly of younger patients who have had myocarditis and pericarditis, so inflammation of the heart. So those tend to be mild and not fatal, and they get better, but it's unpleasant. It's a complication that sometimes results in hospitalization. Without strong evidence that there's additional benefit of getting a booster dose, it's really not appropriate for us to recommend people when there are some risks. So I think that's really why. And again, time will tell whether ultimately there is some interval after which a booster dose clearly is beneficial for 18 to 50-year-olds without chronic medical conditions, but we don't have those data yet. And we're constrained by making recommendations to things that we have good evidence for.
Thank you. Now, the next follow-up belongs to Fox 11 in Green Bay. Fox 11?
Hi. Yeah, thank you for the opportunity for the follow-up. You say that there are risks present for the people that weren't recommended to receive the booster shots. What are those risks?
So as I just mentioned, one example that was more common in younger vaccine recipients, particularly male younger vaccine recipients, was myocarditis and pericarditis. That was really the main side effect or risk that caused people to require medical attention in significant numbers. But some symptoms, some side effects, the fever chills, the feeling lousy for a few days after you get your vaccine are pretty common. And so those, there are very few life-threatening. There's only been, I think, still single digits of side effects, more caused by the AstraZeneca and the Johnson & Johnson related to severe blood clots. So risks are not zero, but they are small.
Thank you. And we're running out of time, so our last follow-up question belongs to Hope Kerwin from Wisconsin Public Radio. Hope.
I had a question about the at-home test kits that DHS is providing. I'm curious what demand has been like for the at-home testing kits and if you still have an adequate supply to meet that demand.
That is a good question, and I will have to get back to you. The program, the Vault testing, where people can request an at-home test kit, has not been discontinued. The volume that it's being used right now isn't something that I know handily, but happy to follow up by email to get you more details that could help you.
We definitely will do that. And that will conclude today's briefing. Our thanks to Dr. Ryan Westergaard and Dr. Stephanie Schauer for participating, and to all of you for joining us. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Be safe and have a great afternoon.